Nurse Aide Test Prep Dallas. Question 1. A client with a catheter should have perineal care performed. Option A, daily during the bath. Option B, at least once a shift. Option C, only if soiled. Option D, twice per shift. The correct answer is option B, at least once a shift. Clients with indwelling catheters need perineal care at least once per shift to prevent catheter-associated urinary tract infections, CAUTI. Daily is insufficient, infection can develop within hours. Question 2. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should: Option A, document it and turn the client. Option B, massage the area to increase circulation. Option C, apply heat to the area. Option D, leave it alone. The correct answer is option A, document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 3. How should the nurse aide communicate with a client who has a hearing loss? Option A, face the client when speaking. Option B, repeat the statement. Option C, shout so that the client can hear. Option D, use a high-pitched voice. The correct answer is option A, face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 4. Which sign indicates a client may need toileting assistance? Option A, restlessness and picking at the sheets. Option B, closed eyes and slow breathing. Option C, smiling and laughing. Option D, sitting quietly in bed. The correct answer is option A, restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 5. When taking a client's oral temperature, the nurse aide should place the thermometer. Option A, under the tongue. Option B, on top of the tongue. Option C, between the cheek and gum. Option D, under the arm. The correct answer is option A, under the tongue. The sublingual pocket under the tongue is the correct placement for an oral temperature. This area provides accurate core temperature readings. Placing on top of the tongue or between cheek and gum does not provide accurate readings. Under the arm is the axillary method, not oral. Question 6. What should a nurse aide do if a client refuses isolation precautions? Option A, ignore the client's refusal. Option B, use restraints to keep the client in the room. Option C, educate the client and report to the nurse. Option D, discontinue isolation. The correct answer is option C, educate the client and report to the nurse. The nurse aide should explain the purpose of isolation and report refusal to the nurse. Restraints are never appropriate without a physician's order. Ignoring refusal or discontinuing isolation puts others at risk. Question 7. The pulse site most commonly used for adults is the: Option A, brachial artery. Option B, radial artery. Option C, carotid artery. Option D, femoral artery. The correct answer is option B, radial artery. The radial artery at the wrist is the most commonly used pulse site because it is easily accessible and does not disturb the patient significantly. The brachial is used for blood pressure and infants. The carotid is used in emergencies. The femoral is rarely used for routine assessments. Question 8. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 9. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A, redirect the conversation to something more pleasant. Option B, provide active listening and allow the client to talk. Option C, tell the client not to worry. Option D, change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 10. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: Option A, document the temperature. Option B, report it to the nurse immediately. Option C, give the client a cold bath. Option D, retake it in 1 hour. The correct answer is option B. Report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 11. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B. Provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 12. When assisting a client to walk, the nurse aide should walk: Option A, behind the client. Option B, next to and slightly behind the client, holding the gait belt. Option C, in front of the client. Option D, far to the side of the client. The correct answer is option B, next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 13. A client who is confused becomes agitated. The nurse aide should: Option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C. Use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 14. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 15. Which approach is best when caring for a client with Alzheimer's disease? Option A, use complex medical terminology. Option B, use short, simple sentences and give one instruction at a time. Option C, speak in a loud tone to get the client's attention. Option D, ask open-ended questions. The correct answer is option B. Use short, simple sentences and give one instruction at a time. Clients with Alzheimer's have difficulty processing complex information. Short, simple sentences with one instruction at a time are most effective. Complex terminology and open-ended questions overwhelm them. Loud tones are perceived as aggressive. Question 16. A client with dementia has incontinence. The nurse aide should: Option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B, offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 17. What is the most important action a nurse aide can take to prevent the spread of infection? Option A, wearing gloves at all times. Option B, performing hand hygiene. Option C, wearing a mask. Option D, isolating all clients. The correct answer is option B, performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 18. To prevent skin breakdown, the nurse aide should: Option A, keep the skin clean and dry. Option B, keep the skin moist with lotion. Option C, rub bony prominences vigorously. Option D, use only powder on the skin. The correct answer is option A, keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 19. The nurse aide should report which finding as a possible sign of abuse? Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A, bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 20. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 21. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 22. What is the correct way to transfer a client from bed to chair? Option A, pull the client by their arms. Option B, use a transfer belt and proper body mechanics. Option C, lift the client under the armpits. Option D, have the client stand without assistance. The correct answer is option B, use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 23. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, respirations decreasing from 16 to 14. The correct answer is option C. Temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 24. The nurse aide's primary scope of practice includes: Option A, performing sterile procedures. Option B, inserting urinary catheters. Option C, assisting with activities of daily living. Option D, administering medications. The correct answer is option C, assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff. Question 25. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores.